Right now, growing concern about common medical screenings that can catch things like cancer or heart problems. A nationwide shortage of imaging solution is putting some of those tests on hold. Our Charlie DeMar with the impact it's having on major hospitals in our area.
You know, the worst place to be during a hospital.
Lucy Cantley is battling colon cancer and being treated in North Carolina.
Well, I had no idea that there was a shortage happening. Scans are very anxiety inducing for any cancer patient.
And to add to the anxiety of her regular CT scans, Cantley was given less contrast solution than normal due to a nationwide shortage during her most recent hospital visit.
Knowing that the scan isn't being done like it normally would be just creates more anxiety.
GE, a major supplier of the contrast dye, was forced to close its Shanghai manufacturing facility for several weeks due to COVID, contributing to the shortage now impacting healthcare systems and patients around the country.
There certainly is a crisis right now in terms of the CT intravenous contrast. We are trying to conserve the contrast by using less per patient.
Dr. Jonathan Chung with UChicago Medicine's radiology department says his hospital saw this coming and stocked up on the contrast dye, but supplies are limited and CT scans are now being prioritized.
If you don't have an urgent condition right now, we may ask that you come in later, 2 or 3 months from now, to get your imaging study.
Along with the University of Chicago, the CT solution shortage is impacting Advocate Aurora Health. Edward Elmhurst Health doesn't use GE as a supplier. Northwestern and Rush both say their patients aren't impacted by the shortage. Nancy Foster with the American Hospital Association says based on public information from GE and the FDA, it could be until midsummer that supply chains are fully restored.
There is a light at the end of the tunnel. It's a little bit murkier than I would like right now.
Charlie DeMar, CBS 2 News.
And if you're scheduled for a CT scan and are asked to delay it, you are encouraged to have a conversation with your physician to discuss next steps or possible alternatives to a CTA scan.